Hi, this is Mark Struthers. Today we'd like to take a look at the work environment. There are many challenges for the medical imaging technologists beyond image acquisition. Each work environment or workplace is different. You may work at a physician's office, or a small rural hospital, or a large urban hospital, or even a major teaching hospital. The work cultures may be unique to each one of these work environments, but there are some things in medical imaging that are common no matter where you work and are challenges for the medical imaging technologist. Altruistically, medical imaging is about providing the best health care. In reality, it's a job. So let's explore the work environment beyond image acquisition. As a medical imaging technologist, you may have to work long or irregular hours, including nights, weekends, or on-call shifts. You may have to deal with stressful or emotional situations involving patients or their families and even co-workers. You may have to follow strict safety protocols and regulations to protect yourself and others from radiation exposure or infection. You may have to keep up with changing technology and regulations in the field of medical imaging. And you may have to cope with the physical demands of the job, such as lifting or moving patients or heavy equipment. Remember, you're doing this for a salary, and it is part of the job. In addition to acquiring images of patients, there are some administrative support functions that must be done in medical imaging as well. Let's explore these, starting with scheduling patient appointments and tracking, reviewing, and recording the electronic orders, consults, and other elements in the electronic medical imaging record, and taking care of the medical systems and modalities. You should be aware of the radiology group and ensure that they are following the proper procedures as recommended by the American College of Radiology, and you are following the American Registry of Radiologic Technologists scope of practice and ethics. Remember, healthcare is a business, and therefore there has to be someone overseeing the budget, expenditures, billing practices of the radiology practice, and complying with the health insurance industry and the state and federal regulations of fees and costs of medical imaging treatments and tests. Another aspect of the job is quality assurance and quality control, which means ordering, maintaining, and calibrating the image equipment and ensuring its optimal performance and reliability, and the optimal performance of those that are operating the different modalities. The physician or the department head or manager or supervisor is responsible for providing training and supervision to the clerical and front desk personnel, as well as the medical imaging technologist. So as we start looking at the work environment, it becomes more and more apparent that image acquisition is just the tip of the iceberg. The medical imaging technologist is an employee of the healthcare industry, whether you work in a physician's office or a level 1 trauma and teaching hospital. There are common challenges in the work environment. The healthcare industry is a challenging and dynamic field that requires constant adaptation and innovation to survive and thrive. It is critical that physicians, nurses, and administrators understand the serious results that can come from a lack of knowledge in utilizing medical imaging modalities and personnel appropriately. Each and every one that works with and impacts on medical imaging is part of the workflow, and we need to optimize the workflow. It is complex and dynamic and has multiple steps and systems. Workflow optimization faces many challenges, such as variability, communication gaps, data silos, and resource constraints. Remember, our job is to communicate medical images and diagnosis for the patient and to the healthcare providers. One of the things we have to look at is silos in medical imaging are a problem that affects the quality and efficiency of healthcare delivery. Silos are isolated systems or units that do not share information or collaborate with other systems. In most instances, the facility has an integrated picture archival and communication system, or PACS, for the transfer of information and electronic images. At times in smaller facilities, what you'll find is that the modality has their own separate storage and retrieval systems, and this can cause delay in getting the information to where it needs to be. In an era of cost reductions and the need to improve operational efficiency without sacrificing patient safety or care, we need to be able to monitor the productivity of the medical imaging technologists and look for ways to improve patient throughput, therefore saving money and time. To increase operational efficiency, we are beginning to rely more and more upon automation, computer technology, and artificial intelligence. The evaluation of medical technologists' expertise in operating imaging modalities and how to acquire diagnostic examination is not a simple or straightforward task. It depends on many factors, such as the type and level of imaging modality, the work environment, the scope and complexity of the imaging exam, the training and certification of the imaging operator, and the supervision and collaboration of the physicians or radiologists. So what are the expected competencies for medical imaging technologists? The minimum qualities for a medical imaging technologist is the knowledge and expertise of patient handling, physics, anatomy, and physiology, and medical imaging techniques to assess these patients. The medical imaging technologist should also be able to spot something that is not normal or abnormal and provide radiation protection to the patient and themselves. The abnormality would be a glitch in the imaging modality or something in the ancillary equipment that they're using. We monitor this using quality assurance and quality control. To optimize their skills, medical imaging professionals need to keep up with the latest trends, tools, and techniques in their field. They also need to learn new skills and adapt to new environments and platforms that are integrated into the work environment. To qualify to be a medical imaging technologist, you need clinical experience combined with credentialing in medical imaging technology. It is an essential component of your education and job performance. In your job performance, when considering the utilization of ionizing radiation or other energies to create medical imaging exams, we need to understand that if they are done appropriately, there is only a theoretical risk of harm to patients. The most risk that a patient would face in an exam which is done correctly is probably a reaction to contrast media, and this is a minimal risk. Unfortunately, there are no minimum standards nationally for medical imaging technologists, and most of the standards are regulations done by the states, and only 75% of the states actually have a licensure. When polling these states, we find that the majority of officials in the states that don't regulate training say it is needed, but they don't have the power because the medical associations hinder their legislative attempts to enact standardization. This is because it has a direct impact on salary and wages and employment. The skill level of medical imaging technologists who operate the equipment or modalities has a direct bearing on whether a potentially fatal condition is identified, treated, or missed. It seems that a national standard would be beneficial for all who work in the medical imaging technology environment, patients, physicians, and the technologists themselves. This lack of standardization makes recruiting and management of medical imaging employees difficult and results in chaos with respect to human resources applications. Your work environment or facility can have a significant role and impact on the skills and learning opportunities for medical imaging technologists. It can influence the scope and variety of imaging procedures they perform and the quality and safety of the imaging services they provide. As we discussed, the interaction with patients and opportunities to acquire medical imaging exams varies between a physician's office, a rural small hospital setting, an urban setting for larger hospitals, and the large teaching hospitals that are found in major cities. Without a minimum standardization nationwide, it's very difficult to take the experience of the medical imaging technologists and match it to the work environment for human resources and management. That being said, the work environment can affect the quality and safety of imaging services that medical imaging technologists provide. The work environment can affect the quality and safety of imaging services that medical imaging technologists provide. Remember, this is a business, and a business has so much profit and so much loss, and they have to have the resources to be able to provide the services for the patient. Working in a poorly equipped or poorly maintained facility may pose challenges and risks to medical imaging technologists, such as malfunctioning or outdated equipment, inadequate radiation protection, or insufficient quality assurance and quality control programs. Quality control involves regular, intermittent technical testing of medical equipment and evaluation of image quality to ensure conformity to the regulations. Quality assurance monitors how we're providing services. Quality control of imaging modalities and ancillary devices has a direct impact on how we provide services for the patient. There are different types of quality control tests for different modalities in medical imaging, such as radiography, fluoroscopy, CT, MRI, PET, and so on. QC tests are usually performed by trained technologists or physicists using specific test equipment or phantoms. A physicist, although they may not be employed by the facility, needs to be involved in quality control and quality assurance programs and can provide services for the facility. Working with uncalibrated medical imaging equipment can have many disadvantages and risks for medical professionals, the patients, and healthcare facilities. Besides the radiation safety risks, there are increased costs and maintenance risks. Uncalibrated medical equipment can increase the cost and maintenance of the healthcare facilities by causing wastage, downtime, or damage to the equipment or machinery. Uncalibrated equipment may also mean a loss of diagnostic information. You're just not able to acquire the diagnostic information from the patient adequately. Uncalibrated equipment or a bad QC/QA program or underutilized QC/QA program can result in poor image quality. This in turn can increase radiation exposure because of the need for repeat exams, and it is a reduction in patient safety and satisfaction with the exams performed. Uncalibrated equipment can compromise the patient's safety and satisfaction by causing errors, delays, or complications in the medical procedure's quantification. The standards and requirements for QC and QA programs may vary depending on local regulations, guidelines, and practices. Unfortunately, the adherence to QC/QA standards often is unbalanced in practice. You may have an outstanding QC/QA program, or you may have a program that is pencil whipped and only looks at equipment when there is a problem. QC and QA programs impact your work environment. A facility needs an overall QC/QA program for each one of its modalities, whether it's radiography, sonography or ultrasound, fluoroscopy, CT scanning, MRI, nuclear medicine, and positron emission tomography, as well as all the ancillary equipment associated with these modalities. Finally, we've come to something that is known as burnout. Burnout is a serious issue that affects many healthcare workers, especially those who work in high stress and high demand environments such as medical imaging, with lots of interaction between physicians, patients, and the medical imaging technologists. Medical imaging technologists or professionals work in a fast-paced, stressful environment that can affect their physical and mental health. They have to deal with high workloads, long hours, complex cases, and demanding patients and physicians, as well as changing technologies and protocols. These factors can lead to burnout, which is a state of emotional, physical, and mental exhaustion. Burnout can impair your performance and the quality of care that you give. I hope this information has been helpful, and thanks for watching. You can find more information on my YouTube channel, Mark Struthers.